is Dr. Vidal here of Pure Plastic Surgery. Welcome back to Tuesday Tips. This is our weekly check-in every Tuesday in the afternoon. Depends on the schedule of the day. We're usually in the afternoon. We meet live in different platforms to discuss different topics of plastic surgery and to answer your questions. So today we are going to talk about fat grafting. Fat grafting is a very broad topic. Why I wanted to discuss it, because it's very common that we talk about BBL because it's a very common procedure that I do and a very popular procedure nowadays. But I usually get asked questions about fat grafting to the breast, fat grafting to other areas of the body. So I decided let's just talk about fat grafting in general. What is it, where we can fat graft, and what is the difference between the different parts of the body when we fat graft, okay? So fat grafting, let's start by defining what is fat grafting, okay? The word graft in plastic surgery and in surgery in general means that we're moving some part of the body from one area to the other, okay? But the difference between a graft and other movements, like for example a flap or a transplant, it's that the piece of tissue or the thing that we're moving. Yes.
We're having a little
technical difficulties.
Let's start again here on Instagram,
okay,
because it's doing like this.
Okay.
It's flashing, so
okay,
give us 30 seconds.
Yes.
Yeah.
Technical difficulties on Instagram account.
Yeah.
So
let's go again.
Yeah, no
Don't
problem.
worry. And let's see. I think it's your phone, Doc. Yeah, for real.
Okay.
Okay, so let's stop here.
Give us a few minutes, you guys.
Yeah, look how it's doing. It's like flashing.
Okay.
So we're gonna end the live here.
Yes, give us a few minutes, okay?
Just a few seconds.
Okay. And then we'll jump back in discussing fat grafting. Start thinking about your questions, and then we'll get to that.
Okay, so 3, 2.
Hey, let's start again.
Okay, now.
Working now?
Yeah, it's working now. Yeah.
Okay, so sorry about that, you guys. So again, we're gonna talk about today fat grafting, okay? Fat grafting, it's a procedure that we do very commonly. I do it for the gluteal region, like more commonly known as the BBL. But it's a procedure that can be done to different parts of the body, okay? So that's why I wanted to just talk about fat grafting in general, and let's describe what is it and why it works better from some areas, and there are some other areas that it doesn't work so well, okay? So let's start by defining what's a fat graft, okay? Graft, the word graft, you might have heard it before. The other common area that we hear the word graft is with skin graft, which basically is it describes moving a piece of tissue from one area of the body to the other. But the important thing is that the piece of tissue that you're moving needs blood supply from the other area, the recipient side, to survive, okay? So it's like moving a plant from the backyard to the front yard, okay? When you're moving it, that plant needs the soil and the nutrients from that other area to survive until we make new roots and it can take the blood supply or the nutrition from that new area. So basically that's a graft, okay? And that's why it's important, and I'll discuss in detail how we make that process and how the recipient side gives those nutrients so the majority of the graft survives, okay? So, like I said, very commonly we hear about fat grafting to the buttock or BBL because it's a popular procedure that has boomed in the last few years, but fat grafting can be done to other areas of the body as well, okay? And this is nothing new, okay? Even though we're starting to hear about fat grafting to the buttock or BBL procedure very commonly in the last 10, 15 years, fat grafting is a procedure that has been done for years, okay? Very commonly it was done for reconstructive options, okay? Very commonly it was done for example, radiation after cancer, to treat that skin, to treat those wounds, because fat grafting contains a lot of stem cells, okay? And we'll talk a little bit about that. So that's how it started. Also to reconstruct or improve congenital deformities. Very commonly, kids that are born with one side of the face that is not as developed as the other and have some asymmetries, it was commonly, and it's still commonly done, that we do fat grafting to balance that out. So like I said, fat grafting is nothing new. What it's been popularized, it's more because of the regions we're doing it, okay? And the changes in contouring that we are able to achieve in the body with fat grafting to the buttock and hip area, okay? So like I mentioned, when we move the fat graft, the fat needs to survive on the blood vessels of the new site, okay? So what are we moving? We are moving the fat cells, those are called adipocytes. And with the adipocytes, we move some cells that are around it that's called, that they're called adipocytes, but they're pre-adipocytes because they're in the process of becoming adipocytes, and those are called stem cells. Stem cells means that they still have the potential to develop into new cells, okay? So that explains a little bit about that fairy fluff period that we all hear and talk about, okay? It relies on these stem cells because, like I said, when we're moving the fat and taking it out, I take not only the fat cells, adipocytes, but the pre-adipocytes that are stem cells with it, okay? So when we move this to the new area, at first, that new area, it basically diffuses the nutrients, okay, for those new cells to start to grow. And those cells, when they start to grow, they start to send signals to the surrounding area, I need blood vessels. So they start forming those new roots or those new blood vessels to get blood. So starts to reach out to the blood vessels and to the tissues around it to get new blood vessels, okay? In that process, there's always a loss of cells, okay? Depends on the area. There are areas that have more fat cell loss than others. Usually in the buttock area, the buttock is a very highly blood vessel rich area. So it has a very good survival of fat. We're talking about 70 to 80% of the fat that we transfer usually survives. In other areas of the body that we don't have a lot of blood supply, like the breast, then the survival of the fat is not that great, okay? And that is one of the things that I put here as disadvantage or complications of this procedure. This is more of a disadvantage, is that it's very unpredictable, okay? Unfortunately, I'll explain a little bit about what we do to try to keep as much as the fat that we transferred that survives and keep it there in that new area, but it's never going to be 100%. And for every person is different, okay? It's very unpredictable to know on you specifically how much percentage are you going to keep, okay? So like I said, we move the adipocytes, we move the stem cells, okay? Where can we move the fat? So there are a lot of different procedures that include fat grafting. I'm going to describe the most popular ones, and we'll go a little bit over what are the differences in each area of the body, okay? One is breast. We are doing fat transfer to the breast or fat grafting to the breast for years. Very commonly in reconstructive breast cancer patients, okay? Why? Because there are two major things when we fat transfer to the breast that makes this procedure not a great one for breast augmentation patients or patients that are cosmetically looking for an increase in volume, okay? One is, like I said, the breast doesn't have good blood supply like the buttock. Okay, it's just the inherent anatomy of the breast tissue. It's more fat and lobules and glands for breast production rather than blood vessels, okay? So when we inject fat in that area, the soil, right, the breast tissue that it's there, it becomes the soil in my analogy. The soil is not great, so it's like planting on a desert, okay? So there are some flowers that are gonna bloom, but the majority of them are not, okay? percentage of fat survival in the breast is not very well documented, but we can estimate to be like 50%, okay? Other thing is that when we are injecting in the breast, we have, because there is not too much blood vessels, we can inject as much fat as we do on the buttock, okay? The reason is because if I inject a lot of fat in the breast and it doesn't have good blood supplies, that fat dies. When the fat dies, it forms cysts. It's fat necrosis, forms little balls, hardness. It might be painful, okay? So that's the reason why I can't go ahead and just inject a lot of fat in the breast and let's see how much it survives. Because I know a lot of it is not gonna survive, and I'm putting you at risk of developing fat necrosis and those cysts. The other problem with the breast is that, and we're going into now October, which is Breast Cancer Awareness Month, is breast cancer in females, right? We have to be screening and checking for breast cancer. So after 40, all of us should be getting a mammogram and an ultrasound yearly to be checking for cysts, masses, calcifications, anything new. The problem with fat grafting to the breast is that because you can have fat necrosis afterwards, then you can start have new lumps, new areas of that in the mammogram, they may look suspicious. It's not that that's going to give you cancer. That's not the case. It's just that it's going to look suspicious in the imaging, which is going to require a biopsy to rule out a malignancy. So usually the people that have fat graft to the breast tend to have more biopsies in their lifetime because they have new little lumps and cysts and microcalcifications that we don't know. Is it a possible malignancy, or is it just fat necrosis from the fat transfer? Because we don't know, we end up doing more biopsies, and those patients, which is a hassle, right? More scar tissue, incisions that we don't like, and obviously the stress, right? You go into a mammogram and they tell you you have something here that we don't know what it is, and it's a couple of weeks of stressing you out when it's nothing, okay? So those are the two main reasons why I don't like to do fat grafting to the breast. Even though it's something that it could potentially be good, those two things make it not a good option. And we have implants which give you volume in a safe way on a one surgery without the risk of, or the hassle of increased biopsies on the breast, okay? So that's with breast cancer, with breast fat grafting. On breast cancer patients, it's different because they don't have breast tissue, right? So we're usually putting the fat in areas where we want to camouflage the implants more than increasing volume and relying the entire reconstruction on a fat graft, okay? But that's another topic. The other area that we can fat transfer to is the face. The face is a very good area that has been getting more and more popular with the new advent and popularity of fillers, okay? The good thing about fat grafting in the face, and I think it's a very powerful thing to do when you're combining it with a facelift, neck lift procedure, okay? The reason is, if you have sagginess in the skin of the face, right? You have usually aging on the face results with descent of the tissues on your cheeks. They fall a little bit. You have hanging skin here and loss of projection in your cheeks. That's usually how the aging process in all of us is going to happen. So what we like to do is fill in the upper areas to try to recreate that volume in the upper area. But if you don't get rid of the skin laxity, then you're just creating more weight, right? You're just filling everything and overfilling and weighing everything on the lower part of the face, which is going to make it worse. So when you combine facelift with fat grafting, you're getting rid of that, repositioning everything, and then volumizing the areas. And it's a very powerful surgery that has very good results. The other good thing about fat grafting to the face is that it's permanent. It's not like fillers that only last for a year. The fat, whatever survives, stays in your face, okay? So it's a very good, like I said, combination procedure, fat grafting with facelift or eyelid surgery for facial rejuvenation, okay? The good thing about the face is that it has a very good blood supply, okay? So the fat grafting take in the face is very good. It's usually very small amounts of fat, similar to the fillers, right? When we're talking about fillers, we're talking about one syringe, only 1 cc. It's similar with the fat grafting to the face. We're not talking about 1,000 cc's like we're talking in the buttock. No, in the face, we're talking about little amounts in some areas to volumize, combining it with the stretch and the repositioning of tissues of the facelift, and it gets very good results, okay? The other area, it's the trunk. The trunk, it's usually an area that we don't really need to fat transfer to. We just take it out, okay? But it can be used especially for asymmetries with liposuction, areas of divot that you want to fill. Usually that's what it's used for, okay? The other big area is the gluteal region. So the gluteal region, it's one of the most popular fat grafting, fat transfer procedures. The most popular that I do here, definitely. And the reason why it's so powerful, it's a couple of things. One is the combination of the liposuction to the trunk with the fat transfer really empowers and really creates a change in the contouring of the body. And how much or how wide or how much projection you want, it depends on your goals, and it depends also on your anatomy and where are we starting, right? But we have that flexibility of recontouring because we're combining the liposuction and the fat transfer. And it's, like I said, it's been popularized tremendously in the last few years because we've seen how much we can change and recontour the body with it. The good thing is that the gluteal region, like I said before, is an area with a lot of blood vessels, okay? The pelvic area, it basically gets all the blood vessels from the legs, and basically it redistributes everything to get back to your heart. So it's the pelvic and hip area is just, sorry guys, it's just an area with a lot of blood vessels, okay? So the fat grafting has a very good take. Like I said before, between 70 to 80% of the fat that we transfer usually survives. What are the things that are important to try to maximize the fat viability? One of it is the harvest, okay? How do we take that fat out, okay? And those things are things that I do here that you have no control over, but I try to maximize it. It's like basically, if I want this flour to survive in that new environment, I'm not just gonna tear the flour and try to put it in. I try to do it gently. I try to do it with the good resources and also the instruments to harvest it in the least traumatic way. So the cannulas that I use, the pressure that I use with the liposuction are all things that I control to try to get that fat out, but that fat keeping those cells as intact as possible, okay? The other thing is the handling. Once the fat is out, okay, how do I handle that? The amount of pressure that we put in again, and how do we process it to then transfer it, okay? And the processing, there's two main ways of processing the fat. One is with centrifugation. The centrifuge is a machine that basically spins whatever the substance that you put in. It's used a lot in laboratories, but basically spins the substance to separate the components based on density, okay? So that's, centrifuge is very good to use for fat transfer to the face, to the breast, where you need very low amounts and you're putting very low fat or very little fat, but you want the fat to be as pure as possible, okay? So centrifuge is a very good, and I use it for when I'm doing the fat transfer to the face, because it separates not only the fluid, but also what's called the oily component. So like the greasy part takes it also out, and you have like basically pure fat cells transferring to it, okay? It does have a little bit of the spin, takes a little bit of trauma, okay? But like I said, for areas like the face and breast is very good because it gives you that pure layer of fat, okay? For the buttock, because we're talking about more amounts, right? We're not talking about few cc's of fat, we're talking about liters of fat. The best thing or the best processing technique that I use, or that's my opinion, right? That the one that I think works the best is with decantation. It's basically letting it sit, and with time, the density of the tissue is gonna create that separation. And I put this picture here so you guys can see. The fluid and the fat has different densities. So when you let it sit, the fluid is gonna go to the bottom because it's more dense, and the fat is gonna go to the upper part, okay? This fluid we take out, I don't use, I just use the fat, okay? And for you guys, so you know, this is just a picture to show you guys this, but this fat I did not use to transfer it to anyone, okay? Because this is not a sterile component. This is just a lipocase that I did, and I'm showing you guys the differences in densities. When I'm doing a fat transfer case, this fat is accumulating in a glass container that's sterile, so it's different, okay? This is just for liposuction and for demonstration of the densities, okay? But basically, when you decant it and when you let it sit, you're not applying any pressure, so it's the least traumatic to the fat, okay? Once it's separated, I use this fat to then transfer it. And when I transfer it, I don't use any power device, I just use the syringe with a cannula, a thick cannula, to avoid more trauma to the fat cells and also to avoid fat embolism that I'll discuss in a little bit, okay? So all those things, the handling, the processing, the transplantation, how do I put it back in your body, are all going to contribute to the fat viability. And the other thing that it's as important or even more important than all of this is the post-op care that you do, right? Because those first few weeks, that, like I said, that fat needs to build up its new blood vessels to get new blood and survive. If we put any pressure, that it's gonna impede or it's gonna affect that blood vessel development, and that fat is gonna die, okay? The other thing, so pressure is one thing, so that's why I ask my patients not to sit for 6 weeks. What's the evidence behind this? There's not much. Why? Because like I said, there's so many components that affect the fat viability that just seeing one, like pressure, sitting, it's not gonna tell us much. And because each person is different, it's very hard to standardize. But what do we know? We do know that by 6 weeks, the new blood vessels are formed. And that we know is a fact. So my recommendation to all my patients is don't sit for the first 6 weeks, okay? I know there are other surgeons, other people that say, oh, I sat 1 week out. I sat 2 days after my surgery and I was fine. Like I said, there are a lot of components that affect fat viability. Whatever you can do to optimize your results and optimize the fat viability, that's on each person. And that's why I tell my patients not to sit for 6 weeks, because it takes 6 weeks for the body to make those new blood vessels. Once the blood vessels are there, then yes, you can put pressure to the fat and it's fine. It's like sitting. It's like me sitting. It's like you sitting without a BBL, right? The fat is not going to die because it has its blood vessels there. Okay, so that is the reason for the 6 week period. Okay, so that one is one of the most important things for the post-op period. The other thing is the nutrition. Okay, so while this is growing, the metabolism in the area is very high, so those cells need a lot of nutrients. Okay, so trying to lose weight or not being on top of your calories in that early post-op period, it's going to affect how much that fat survives. And that is a very tough part of the recovery that most of my patients don't realize, because they're like, yeah, I'm always hungry, I'm gonna eat. Well, after surgery with the medications, with the pain, you're not gonna feel back to yourself in those first few weeks, so you're not, and the level of activity that you're gonna have is not the same. So you're not gonna, most of my patients are not even hungry, okay? So to maintain the calorie count that you had before the surgery is actually hard, okay? So I advise most of my patients, if you're not making the calorie counts that you had before surgery, it's important that you complement, okay? Protein shakes, shakes in general, but basically High calorie protein shakes help a lot because you're, like I said, you're not gonna be hungry, you're gonna feel full, and that's gonna help you keep your calories so you keep feeding the fat, okay? And after those first 2 to 3 months, those stem cells, if you took care of them, if you fed them, if you avoided pressure, those stem cells are gonna grow. And that's the fluffing period, okay? So those stem cells are gonna blossom and they're gonna create that fluffing effect that some of your patients describe, okay? One is that, and also the other thing that creates that fluffing is the skin settles. The skin at first is very like tight because I've like filled it in with fat and it's just like trying to expand with all that new volume. It takes a little bit for the skin to kind of relax, and that's also the other component of the fluffing on the post-op period, okay? And hand rejuvenation is another area that it's booming. Hand rejuvenation, it's basically in the dorsum of the hand. When we age, we lose fat in this area. And you can tell, and you've probably heard people saying that you can tell the aging of a person from the hands and the neck. Those two things give us away. And the hand part is because we lose some fat there. So we start to see our tendons and our veins more, okay? So we're seeing it more and more with fillers, that you can inject fillers in the area to recreate that volume and camouflage the tendons and the veins so that it looks fuller and younger. But fat transfer is an option because you can transfer fat to that area, and that basically creates the same effect but permanent rather than temporary with the fillers, okay? The other area is like I mentioned, reconstructive area like radiation, contracture burns, and all that you can use, and basically the fat transfer effect and improvement is based on the stem cells that we have in that area that I mentioned, okay? What are the disadvantages or complications of fat grafting? One, like I said, is very unpredictable how much it survives. There are things that we can do to try to maximize the survival, but it's very unpredictable, patient dependent. The other thing that's a disadvantage to some, but to some it's not as much of a disadvantage, is that the fat grafted area or the fat grafted, it's gonna change with weight changes, okay? Once that fat is in its new house, right? It's either the face, the buttock, wherever we transferred it to, it's gonna behave like fat in any other area. If you gain weight, it's gonna expand. If you lose weight, it's gonna decrease. So it's part of your body, it's part of your fat, so it will have changes with weight. So my advice to my patients is that you need to be close to your ideal body weight for surgery so you can maintain that post-op and you maintain your results longer, okay? And the other risk is fat embolism. And fat embolism is a very critical and important complication to talk about, especially in the gluteal region. Why in the gluteal region? The same way that the gluteal region is good because it has good blood vessels, it's also dangerous because it has a lot of blood vessels, okay? So if we inject fat in one of those blood vessels, it can travel to your lungs, and it's called a fat embolism. There's not good exchange of oxygen, and it can even cause your death, okay? So how do we prevent this in the gluteal region? Is by using the ultrasound. With the ultrasound, I'm seeing with my own eyes where I'm injecting the fat. If we inject above the muscle or in the subcutaneous space, then we don't have those big blood vessels there. The big blood vessels are in the muscle and below the muscle, okay? So if we inject in the muscle, then there's the risk of fat embolism. If I inject above the muscle or in the subcutaneous space, we don't have those blood vessels there, we don't have the risk of fat embolism, okay? So it's important to research where you're going to do your procedure, and that the person doing your procedure is doing it with an ultrasound and also is proficient and well known to use the ultrasound, so they know what they're seeing and they're keeping the cannula where it's and the fat transfer where it's supposed to be, okay? So I hope this helped know a little bit about fat grafting. I'll take some questions now.
First of all, do you do fat transfer to the lips?
Yes, that is an option. Yes. So to the lips, same as when I talk about the face, it's good to do a very subtle increase in volume. Okay. But yes, it can be done, especially when you're, like I said, doing full facial rejuvenation. It's good to add a little bit to the lips to match the change in volume in the rest of the face.
The fat that doesn't survive in a BBL, where does it go?
So the fact that it doesn't survive, basically those cells, they die, so your body kind of absorbs it. Okay. If it's a big area, then you can have fat necrosis. Okay. So when we're injecting, and there are a couple of videos that I've put in my Instagram when we're injecting, that you guys can check them out. But basically, when I'm using the ultrasound, the cannula is in the subcutaneous space, and you can see, I can see, when you're injecting, there's a little cloud of fat that forms. Okay. And the important thing is to kind of spread that cloud of fat. Okay. Because if I put a lot of fat in one place, then that's gonna basically create new blood vessels around it, but the center of that is not gonna have a lot of feed, and that's gonna create fat necrosis and a mass, and that sometimes you can palpate it, it can be painful, and it can create like a lump in the area.
Can you get a BBL and breast implants at the same time?
I don't do that. I don't combine those procedures. I know there's people that do. The reason that I don't like to combine those procedures, a couple of reasons. One is because I'm doing surgery in the state of Florida. Department of Health here in Florida has a limit of how much fat I can remove when I'm combining procedures. Okay, so if I'm combining a BBL with a breast augmentation, implants, tummy tuck, any other procedure, I can only remove 1 liter of fat with the BBL, which is not going to be enough to create a change in contour and make the procedure worthwhile. Okay. The other reason is the recovery. When I'm doing implants or breast procedure, I'm going to ask you to be sitting up a little bit to decrease the swelling in the breast and to not put pressure on the new sites. And for a BBL, I'm going to ask you to do the exact opposite. I'm going to ask you to sleep in your belly to avoid pressure in the buttock. So I don't really like to combine those two because I don't really think you're going to have a good recovery with both of them.
Okay. What if you don't want a BBL but want 360 lipo with curved appeal? Can that happen with just 360 lipo?
Yeah, definitely. When we are doing the lipo 360, we can create a lot of contouring, and it has a limit, okay? Because it's only removal, okay? When we're combining it with a BBL, you have more flexibility of the contouring because you can take out and put in certain areas and has more power to that, okay? But if you have a good foundation, so if you do have, let's say, if you see yourself in the mirror and your waist to hip ratio is already favoring a thinner waist and a wider hips, then maybe just the lipo 360 is going to create that contouring. And by focusing in the flanks and lower back area, even I'm not injecting fat in the buttock, there is some contouring of that region, which by comparison, when you see yourself later, it seems like I injected fat. And I have a lot of patients that only do lipo 360 and they're like, you had to inject fat because my buttock seems larger. And I'm like, no, it's just by thinning your torso, just proportionate wise, you're gonna look a little bit wider on the hips and buttock. But it all depends on your foundation and how your hips are and how your buttock is from the beginning. There are patients that see the difference, there are patients that don't. So if you have questions, just fill in the virtual consultation, send the pictures, and I can tell you a little bit more about your particular case and what are your goals, and we can discuss if you will benefit only for the lipo or with the fat transfer too.
Okay, this is in YouTube. Is it real when you're doing a second round BBL that the fat has more chance to survive?
Not really. It's just that in that second BBL, the skin has already been stretched in the hips and buttock region, and you have a foundation of the shape that you're wanting to achieve. So it's when you go for the first BBL, and let's say you have very thin hips or very narrow hips, to try to start expanding that area sometimes requires more than one round, because the skin is going to stretch to a certain degree, okay? And also the fat, it's not going to stay in certain areas. Sometimes if the skin won't stretch, it starts to push the fat up and create more of a lat or high hip contour. So you need to wait, give your skin time for stretching, and then on a second round, then you have that foundation of that skin already stretched, and that shape can be achieved better. So it's not that the percentage changes, it's just that the perspective and where you're starting changes, so you can see more of a dramatic change on that second round.
Okay. How long is the wait for a BBL after a tummy tuck?
So after a tummy tuck, you should wait at least 3 to 4 months to do a BBL. Okay, you want the incisions to be well healed, and you need to feel that you're a little bit back to yourself so you can restart a healing process, okay? So for some people, 3 to 4 months is okay. Some people need a little bit longer time, okay? But at least 3 to 4 months. But if it's the other way around, if you decide to do the BBL first and then you're gonna do a tummy tuck, it's better to wait 9 months to a year, okay? It's something that for most patients, it doesn't make much sense, but trust me when I say with liposuction, you have more scar on the inside than with a tummy tuck, okay? The tummy tuck may have longer scars on the outside, but the amount of healing on the inside of the skin that needs to happen and the scar that happens, it's more with Lipo 360 that we need to heal before going and trying to pull that skin and do a tummy tuck.
Okay. Do you do breast augmentation with fat?
So yeah, so like I explained here on the presentation, the two main reasons that I don't do fat graft to the breast is one, the breast doesn't have good blood supply, so usually to get at least a cup size difference, you need more than one surgery. So it's usually 2, 3, 4 procedures of fat transfer to the breast to get a noticeable result. And the second is because then we have increased risk of having cysts, lumps that may show on a mammogram that may need biopsies in the long run. So it's just, it's more of a hassle for you.
I have a question in Spanish. Can we take it?
Of course.
Ok. Hola, doctora. Tengo una pregunta diferente al tema. Tengo 3 meses desde que me operó. Ya me puedo hacer un tatuaje en mi ombligo. Me hice un BBL, pero hace un año tuve un tummy tuck.
Ok, y llevas 3 meses operada, sí, después de 3 meses ya está todo sano y te puedes hacer un tatuaje después de que no tengas ninguna herida abierta, después de que no tengas ninguna herida que todavía esté como que un poquito abierta, sanando. Después que todo esté sano, a los 3 meses sí, pero siempre mandarnos un mensajito por Clara para saber específicamente tu caso y darte la recomendación dirigida a ti.
Okay. Is it possible to stab an organ while performing a procedure? That's my fear.
Wow. Is it possible? It is possible. Has it happened? It has happened. Has it happened to me? No. So when you're talking about, especially liposuction, right? Liposuction is a procedure that you put a cannula and you basically blindly do removal of the fat in the subcutaneous space. If you have a patient that has different, sometimes and the anatomy is different, the concavity of the ribs is different, and the position of the patient is not optimal, you can have organ injury. That's extremely rare with liposuction, and like I said, it's never happened to me. Things that I do to try to prevent this is positioning, one, and also the angle that you're doing the procedure. So it has to be an experienced person doing the surgery. So that's why it's important to check where and who is doing your procedure to make sure that they're well experienced in liposuction and seeing their complication rates, okay? So again, is it possible? It is, but it's very rare. And if you go with an experienced surgeon in a place that safety is a priority, this shouldn't be a complication that you should worry about.
Do you do lipo of the mons area in a tummy tuck?
Depends, but it can be done, okay? It usually, if you have, so there are two things in the mons area that we can target. One is excess fat that it may happen, and if it's just excess fat, then with a little bit of liposuction to that area takes care of it. The other one, it's called ptosis. So it's basically that area has excess skin and fat, so it's a little bit redundant or bulgy. Okay, if that's the case, then with the tummy tuck too, I can lift it. That's called a monsplasty. Okay, and usually with the tummy tuck, I do it, some sutures on the inside to try to kind of lift it and takes care of that bulging. So it depends, but yes, we can take care of that area with a tummy tuck. Okay, awesome. Thank you so much for the questions. This will be in my page and in YouTube, so you guys can check it out later. Send me some things that you, topics that you want me to discuss for next week, and I'll see you back next Tuesday with Tuesday Tips with Dr. Vidal. Bye, guys.